It's important to stress that this will ultimately be a decision for a patient's treating doctor to be confident that providing 2 months' supply of medicines is appropriate given the stability of their condition. Now, in many cases, these patients will have been on these medicines for many, many years. I talked to someone yesterday in their 40s who has been on the same medicine since they were 15 and at the moment has to go to a GP every 6 months and a pharmacist every month, paying co-payments each time they make that visit for a medicine that they have been receiving in pretty much exactly the same way, not just for years, but for decades. This is the sort of patient who will be provided with the opportunity of much less convenience and half the cost. Now, it's important to stress that this is not unusual. This policy is not unusual across the countries to which we usually compare ourselves. In fact, the current policy restricting these common medicines for chronic disease to only 1 month's supply is quite unusual. 2 or 3 months' supply of medicines operates now in the UK, in New Zealand, in Canada, in France, Germany, many parts of the US, and a number of other countries besides. This is a very common practice across the world. And I want to stress also, this is not new advice. The former government was provided with this advice from the Pharmaceutical Benefits Advisory Committee, admittedly for a smaller tranche of medicines, only about 130 different medicines, but they were provided with this advice back in 2018, 5 years ago, and faced with a choice between providing patients with a substantial cut to the cost of their medicines or doing nothing, the former government chose to do nothing. And as a result, over the past 5 years, patients with chronic disease have literally shelled out hundreds and hundreds of millions of dollars in co-payments that they didn't need to shell out. We're going to put an end to that. This will halve the cost of medicines for, we think, 6 million patients living with chronic disease. At a time of enormous cost of living pressure, we think 6 million will reap these savings. It's also important to stress that cheaper medicines is not just good for the hip pocket, it's also good for the patient's health. I've said a number of times that the ABS, the Bureau of Statistics, says that as many as almost 1 million Australians go without a medicine or defer getting a script filled because of cost. We know that dropping the price of medicines is better for patients' compliance with their medicines that their doctor has prescribed as important for their health. We also know from overseas evidence that having a larger supply of medicines for patients in chronic disease improves medication compliance by as much as 20%. We know that people go off their medicines often when they come to the end of a script because they have trouble getting their script filled, getting into a GP, because of a busy life, or because they run out of their tablet supply and find it difficult to get to a pharmacist. Not only will this be good for cost of living for these 6 million Australians, we're confident it will be good for their health and improve medication compliance as well. Now, I want to stress that the savings that the Commonwealth Government will make from this measure, which are significant and amount to about $1.2 billion over the forward estimates, will be entirely reinvested back into community pharmacy. Every single dollar we save from this measure will be reinvested into programs and services delivered by community pharmacy to Australian patients. In particular, I want to see pharmacists delivering more services, more health programs, using all of their vast skills and training as health professionals for the benefit of their customers and their patients. I value the work of pharmacy very highly. I think there's much more that pharmacists, well-trained pharmacists, can do to support the health of their community. And I want them doing more than just dispensing and processing repeat scripts. They can be doing more if we're able to get them out from behind the counter, working directly with patients on their health needs. Further details of these measures will be released over coming days. I can indicate in particular that we will be providing additional support to pharmacies in rural communities, by doubling the rural maintenance allowance that is provided to pharmacies in rural areas, given the particular circumstances that we know health services in those parts of Australia face. But I do want to reiterate, every single dollar that the Commonwealth will save from this measure will be reinvested back into new spending on community pharmacy programs. In addition, I want to announce a change to a program that we inherited that was announced in the latter part of the former government's tenure to improve medication compliance and medication reviews in residential aged care facilities. The policy announced by the former government would have had that program delivered through aged care facilities themselves. I'm announcing today a change to that policy so that the $350 million allocated in the budget for that measure will instead be delivered by and through community pharmacies. Again, giving those pharmacists an opportunity to show the value that they can provide to the community in delivering services rather than just processing repeat scripts. This next phase of the government's cheaper medicines policy is safe. It's good for the health of 6 million Australians, and it will halve their costs at a time of unprecedented cost of living pressure. Now, I would have liked to have the opportunity to see the opposition support this important cost of living measure that's good for hip pockets and it's good for the Australians' health. I see, though, already Peter Dutton has come out in opposition to this measure even before the details of the measure have been announced. Now, perhaps no one will be surprised that Mr Dutton, given the choice between backing patients or backing profit, has yet again decided to leave patients out in the cold. That's all consistent with his time as Health Minister and with the record of the former government, when, having been provided with this advice that could halve the cost of medicines for millions of patients with chronic disease, decided to do nothing and have those patients continue to shell out hundreds of millions of dollars unnecessarily.